Self-care for caregivers. So, right, this is what I want to start with, this idea of caregiving and receiving that need to happen all together. There's a phrase that I've been taught called pathological altruism, and I see it all over the place in the health professions and in just good caring people, where there's so much need and there's so many gaps in the systems that are meant to support us, that as a caregiver, it feels like I can't, there's no time for me to care for myself. And it can feel even shameful, or like my job is to care for somebody else, not myself. I'll sleep when I'm dead kind of phrasing. Where this idea that you don't need anything as a caregiver, your job is just give. Well, no, don't swallow that. Don't take that. That does not work for more than a few hours, really. And the healthcare system is littered with people who took on that mantle and found themselves burned out and crusty and scarred. So a big frame shift here, guys, is to understand that your job, even if your job is to be the best caregiver in the world, I would still say job number 1 or 2 for you is taking care of yourself, because you are an instrument of care for another person. Therefore, there's consequences to how well you are feeling, how well you are doing. So you have to elevate your own care right next to, in some ways above, the care of the person you're charged with caring for. It's a heck of a sentence. Because if you're empty, if you're toast, there ain't nothing you can give. So this is really, really key. We need to remind ourselves of this again and again, because caregiving over time can be really hard. It can really yank on you. So if you don't uptick your own needs, you will be steamrolled right over. And not only will that feel crappy for you, that feels terrible for your patient, the loved one, the person who on some level will be aware that you're wrung out on their behalf. And that's where it starts creeping in, this infamous word of being a burden. And so many of us as patients feel like we're a burden. The number one reason people want to hasten their own deaths is because they feel like they're a burden. So you as a caregiver can push back on that by finding some joy in your work as a caregiver and some pride in it, and including caring for yourself. That will help your person, your patient, in indirect and direct ways. Okay? And that will tamp down that penchant for them to feel like a burden.